So I'll give you a brief overview of the type of work that I do. So it's really focused on measuring and motivating behavior change using sensors and sort of thinking about that for mobile health or M-health. So there are a couple of assumptions I make. One is that mobile devices with real-time feedback create novel and hopefully engaging behavioral measurement and intervention options that really can't be achieved without that technology. And that the timing and delivery of tailored information is really important for behavior change. So I'm looking for things that only computers can do, and then exploiting that to do something really new in medicine or really new in health. So the primary interests are continuously measuring and computationally modeling, I would say, messy behavior. So people are messy. They don't do things the same all the time. From noisy mobile sensors. So the sensors aren't perfect either. And figuring out how to use mobile and in-home sensors to just understand what people are doing. So we want to mathematically model messy concepts like cooking, walking, bicycling. What does that look like from a set of messy sensors? And that's really a computer science and / human-computer interaction problem. So applied pattern recognition is important here. And then creating innovative, just-in-time health interventions that help people make behavior changes using tailored and context-sensitive real-time feedback. So this is taking this stuff, knowing a little bit about this messy behavior, and then saying, what can we do with it now in health? And in particular, if we understand people's behavior a little bit, how can we do something really, really new? So I think the opportunity is for research, interesting research is human-computer interaction, sensors and machine learning, and behavioral science. And so I'm trying to sit essentially right in that space and optimally innovate in all three of those areas. We want to leverage consumer electronics and mobile technologies that give us this information about what's going on, and then focus at a variety of levels, everything from the body to the workplace, while people are out doing what they're doing, and then think about, okay, now, what are the opportunities that creates for us? How is that going to change the way that we think about health? So the engineering allowing us to do some of this is getting closer. And one of the things my group looks at is how to do this. So we want to take a variety of sensors, whatever we can get our hands on, and then say, can we take machine learning algorithms and then detect things like physical activities, activity type, intensity, duration, but also other behaviors or physiological states, and then take advantage of self-reported information when it's there. But then you can say, if the computer can do this, then what sort of health applications can I build? And you could look and say, I could detect a change in somebody's activity, but I think the real thing is to motivate behavior changes at what a teacher would call a teachable moment. So that's where the timing comes in. So the inspiration for what I'm trying to do, you can kind of sum up in a simple example. So if you want to increase your brisk walking, and in scenario one, somebody gives you a pedometer and says, at the end of the day, get 10,000 steps. And at some point during the day, I look at it, and I have 1,500 more steps to go. Okay? Then I say, all right, tomorrow I'll do better. And then I try to do better the next day. If you take the exact same scenario, but instead you get some sort of just-in-time phone app, and when I'm walking, I get a notification that I have 1,500 more steps to go. I'm much more likely in the second case to get the 1,500 more steps. And the only thing that's different about it is the timing of the delivery of information, not even really the content, the timing of the delivery of information. So the thing that I'm most interested in is how we can use technology to take advantage of timing information. Because people can't do this, but computers could. And so I think that's really sort of the place to think about research. So if the second's more likely to work, the timing and delivery of information is really important. Now, how can we do research to figure out how do we maximally exploit that sort of timing? So the strategy is to essentially take simple messages and present them at the right time, right place in a tailored and non-disruptive way, and repeatedly and consistently in some manner, and see then, okay, how much impact can we have on behavior change? And to do this, we need computational sensing to get the right time. We need portable computing to get the right place. Tailored and non-disruptive is user interface design, and then repeated and consistent is patience, and computers are very good at that, and people are not. So this is essentially what we're trying to do in my research group, and we need all of these things to do it really well, including patience, because one of the things that we do is try to deploy this stuff with real people out in the real world, and that's a lot of work and takes a lot of patience on the part of us and effort, as well as patience on the part of the computer. So in terms of how we do that, I have a variety of projects that are using different types of sensors, but I've done a lot of work with physical activity sensors in particular, in part because I think they're the low-hanging fruit for getting our phones and our computers to know more about what we're doing. So if your phone right now knows that you're sitting and you've been sitting for a long period of time, that's a really good starting point for it to start to infer higher level things like you might be in a meeting right now. So combine that with location information, combine that with your past history of what you have done or might usually be doing, and suddenly you can start to think about the computer having a richer and richer perspective of what you're up to. So we do things like we built our little Wocket sensors, which are wireless mobile sensors. And then in the lab, we instrument people with lots of different types of sensors, have them do different things, record what they do, and then try to develop algorithms that can detect, are they sitting, standing, walking, running, bicycling, that sort of thing. So that's one type of thing that we're doing. And then we're looking at how do we scale things up to a population scale. So ideally, we'd like to be able to run experiments where there's a person with a mobile phone with a sensor in it, and a researcher can go to the App Store and put an experiment on there, and then somebody can run that on their mobile phone. And the mobile phone might do a little bit of detection of what that person's up to, and then the researcher can essentially send new surveys to that phone to gather information. And then the person sends their data back to the researcher. The researcher then may add these little Wocket type of sensors to send them off to the person. The person wears them however they want, and then the phone is detecting in much more detail what are they doing on a regular basis, so essentially a minute-by-minute basis. And the phone, at that point, can also then provide feedback back to the person. And so we can think about making some very compelling interactive experience where the person's getting real-time feedback based on what they're actually doing by wearing sensors that they essentially wear 24 hours a day. And you can start to think about measuring things like sleep, all their physical activity for sure, and then through self-report, possibly things like their physiological state or emotional state in some manner. And the real challenge here is how to encourage this type of thing. So we might be able to start doing studies where we have thousands of people wearing sensors for years, right? And that's the type of thing we just haven't been able to do up until now, this type of detailed information about an individual. So I think that's pretty exciting, and here's an example of data from me where I've self-labeled these things, but we're working towards getting as much automatic labeling as possible. And you can see throughout my day here, this is a wrist sensor and a leg sensor, and you get very sort of distinct patterns, and then the algorithms try to figure out what is it that people are doing. On the pattern recognition side, the interesting thing is that a lot of engineers do this, and they do it in the lab, and the human's not in the loop. But to make the pattern recognition work really well is going to require the human in the loop. So there's a connection between the pattern recognition and the human-computer interaction that I think is an interesting one. I've also done work, and we'll be doing in the future more, both home and mobile. So little sensors that you can go into somebody's house and kind of scatter them around, and then also observational things that kind of look like lamps, and you can put them in people's homes, sort of gather data about what people are doing within that home context, and then think about how do I recognize things like cooking or socializing, and then how would I build systems around those. So here's an example of some of those tools. And then finally, once you have some information, if the computer can detect some of these things, then you think about just-in-time interventions, and we're built a variety of different mobile applications, some of which we're testing. This one, for example, is is a weight loss application that's in a study with 360 people down at Duke. And the goal here is to see, do 18 to 35-year-olds lose weight over a 2-year period? So that's some of what we do is small pilot studies in the lab, and then some of what we do are large studies. In that case, the study takes 2 years. So the whole study is a pretty long process because the people are in it for 2 years. And the first group ends in January, and we have no idea whether or not they've lost weight or not. So it's a true experiment in the sense that the team at some point is going to find out, did they actually lose weight or not? And it'll be interesting to see what happens. So for more information, you can go to the group's website here, and there's a description of some of these projects. And I'm happy to answer emails as well, so you can send an email to me. All right. Thank you.